these presentations are very insightful as to how the services can develop further. Now, when it comes to, the community-based model, um, what is the, do we have an idea about what is the need that we have to actually address, like in terms of numbers, how many people may be requiring this service? And then you mentioned about the network that we have at community level, and now we know in a division secretary's office, you said you mentioned about 20 people, but not all are probably involved. But division secretary area is a very big area. So we know that with the primary care reforms and strengthening, there is a very there's a big opportunity where at the empaneled population to the primary care, when they identify a person who may be more suited for community-based treatment, then that is the place where they can link. So there is a possibility, of help being bridged with this kind of support. So it will be useful to see what were the outcomes. Outcomes can also be followed up through the primary care system, and if necessary linked with the secondary care level also, because that's the way the services are organized. So I really wanted to know whether you've understood the need and match this, because this is obviously a pilot that you mentioned. Thank you.
Thank you very much for your attention, madam. So with regard to the service requirement, so according to the service delivery pyramids, so very few people need long-term residential treatment care. So when we are conducting the psychological screening test, so most of the drug users are in moderate and minor level of addiction. So we propose community-based treatment ideally for the minor level and moderate level drug dependent persons. So others need to refer to the residential and long-term care services. So with regard to the service delivery through the DS divisions, actually many of the government officials are located in DS divisions. They are working for different subjects and under different ministries. So actually it's not much integrated services still in Sri Lanka. As example, when our outreach officers are working in the community-based in DS divisions with the support of other government officials, community correction officers and counselors of the social service ministries, and few government officials are directly involved in community-based treatment programs at this moment. But we need to get support of other government officials to the community-based treatment programs. That's why we identified some advocacy part and some capacity building part should be done for the other government officials, and we have developed one of key manual for the community outreach services targeting the community-based treatment models. And as our chairman mentioned, so these days we are working to revise and update this manual with the support of Ministry of Health. So most probably we can start the training programs for the government work officials who are working in DS divisions to get their maximum support for the community-based treatment programs. Then we can address diverse problems of the SOD persons through the community-based model.
Thank you. I think since we are running short of time, so we can move on to the concluding session. If you have any questions, you can speak to the speakers during the tea break.
Ladies and gentlemen, as we bring this important session to the close, I wish to express my heartfelt appreciation for the chair of the panel and also our expert panelists and also the presenters from National Dangerous Drugs Control Board. Most importantly for the audience, for your active and interactive participation in the session. Let us leave this session inspired to move from discussion to implementation, bring together our expertise in policy our practices on the ground, and our shared commitment to public health. Only by working together can we truly create sustainable and people-centered solutions to the challenges of substance use. So, ladies and gentlemen, thank you once again for your active engagement. Let this be the beginning of many more collaborative efforts to come. Have a nice day. I am Isuri Ratnayaka from NDDCB. Thank you so much.
Thank you, Ms. Isuri Ratnayaka, and thank you to all our eminent speakers for their valuable contributions, and your views contributed a lot to the field of substance use and public health for bridging the gaps through policy, practices and partnerships. It's time to appreciate our panelists for extending their valuable time and effort in conducting an insightful session. Now I cordially invite Professor Upul Senarat, Chair Professor of Community Medicine, University of Colombo and Scientific Co-Chair of the Summit, to kindly present the tokens of appreciation to our panelists. First, Professor Amila Isuru, Professor of Psychiatry and Head of the Department in Psychiatry, Faculty of Medicine and Allied Sciences, Rajaratna University of Sri Lanka. Then let's move on to Dr. Manuja Pereira, Senior Lecturer in Public Health, Faculty of Medicine, University of California. Dr. Ananda Ratnayaka, Chairman, National Authority on Tobacco and Alcohol. Thank you, sir, for joining us to present the tokens of appreciation. May I now kindly invite Dr. Indika Vandinayaka, Chairman of the National Dangerous Drug Control Board, to kindly present the tokens of appreciation to Ms. Serusi Malekam, Scientific Officer, National Narcotic Laboratory of National Dangerous Drug Control Board. Mr. A.T. Darshana, Assistant Director, Research, National Dangerous Drug Control Board. And finally, Ms. Isuri Ratnayaka, Assistant Drug Education and Information Officer, National Dangerous Drug Control Board, for moderating this very informative session. Thank you, sir. Next, I kindly invite Professor Nuwan Vikram Singha, the Chair Professor of Community Medicine, Department of Community Medicine and Allied Sciences, Rajaratna University of Sri Lanka, to present the tokens of appreciation to our chairpersons, Professor Upul Senarat, and Dr. Indika Vandinayaka. With that, we conclude our plenary session 2 on substance use and public health. With that, thank you all once again for your active participation and attention. You are now warmly invited to join with us for the refreshments. And with the